Administrator Kate Nagel. I'd like to welcome in my next guest, Mike Galipeau with the Rhode Island Users Union. Thanks for joining us today.
Thank you.
You're part of a group today that is busy pushing the General Assembly. Again, this is opposition to the drug homicide bill that would make it a life sentence if someone was involved with the distribution of a substance that ultimately someone ended up dying of. But there's a lot of concerns in the medical and recovery community about this legislation. That's what we'd put up. And I wanted you to come in here to tell folks a little bit about why you're in that camp.
Yeah, well, I think the easy answer is I fit the description. You know, I'm a person who's been convicted multiple times of sales, manufacturing, delivery, and yet here I stand, right? And it was only because of the persistent efforts of groups of advocates that believed in my capacity to change and my capacity to recover from the circumstances that I was living in. And it was that persistence that gave me hope that I could change and that I could make a difference too. And that drove me to go back to school. It drove me to become a social worker and to pursue a degree in that. I graduated the top of my class at Rhode Island College. Finally reaching almost 5 years of continuous sobriety, and so it's been a very important part of my story to be able to spread the message of hope with other people. And how can I do that if we put them in jail for life?
And again, we've seen testimony from both sides of it. You see from families who want to see some sort of consequence for this. But talk with us a little bit. As you said, having had the history. Especially just talk a little bit about the Good Samaritan law. So, if someone inadvertently, got some a bad batch of drugs and passed it along, and they were the last one, and the person ended up looking like they were overdosing, would this present an issue for the Good Samaritan law?
It most certainly would, and I think that this has been raised, and we've raised this with the Attorney General's office. My colleagues at RICARES have sat down with the Attorney General's office, have raised these concerns, and they waited until the very last second to present another version of the bill that did almost nothing to alleviate those concerns. And that was very concerning to us, that they wouldn't consult with their partners, that this was really left until it was presented to the legislator for a decision, and it didn't reflect any of the feedback that we've been given. And we have broad support from virtually every major player in our medical community and in our recovery community, supporting other ways to address the opioid crisis. I think that our efforts to do that through introducing medication-assisted treatment by allowing people who are getting released from incarceration to have access to medication when they're leaving is led to a decrease in overdose death. We saw almost a 10% decrease in overdose death from our final summary from last year. And I think we want to continue down that path and causing for people who are incredibly vulnerable and people who are already impacted very negatively by criminalization and by legal enforcement. We need to do everything we can to really be supportive of those people where they are and embrace them into our medical community and ask them to participate. And we can't do that if we're simultaneously saying that we don't believe in your capacity to change and we're going to lock you away for life.
And so do you think, clearly law enforcement, I'm sure, is looking to just to stave off that sort of drip of where the drugs are coming from. And this is the most connected to if there's a fatality involved. Who should law enforcement be looking at and going after? Can they get to those big networks that are enabling these drugs to be on the streets?
So the biggest problem we have in being able to do that is that we don't have any regulatory process at all. It's pretty much economically driven, purely economically driven, and we don't give consumers any education or power to protect themselves. And I think that some of the recent studies that have come out around such interventions like fentanyl test strips that show a very high degree of promise for folks that want to keep themselves safe, that they can avoid overdose death, they can take some additional measures to ensure that they're not dying from the symptoms of their illness. And I think that's really important to touch on, is that all of these things that we, the financial barriers, the exchanges that occur within that underground economy, the interchangeable roles, how actors change day to day, it's almost impossible for law enforcement to be effective in delivering like a true investigatory type of reaction, because you have to go so far back along the lines and it's so blurred as far as like individual responsibility that the best way that we could do this is to empower our consumers through education. And so that way they have the tools to make an informed decision about whether or not the substance they're going to consume has fentanyl in it, right? And if they know with a certainty and they still choose to do it, then you could say that they're taking personal responsibility. And right now we just don't have that level of access within our system.
Do you think within the community that does use drugs that they will utilize these fentanyl test strips?
So we have two different studies that were done in two different states. One was done right here in Rhode Island that's being published in the coming month. And there was another study that was done in North Carolina with the Urban Survivors Union. Both of those studies had significantly, overwhelmingly positive results for behavior mitigation. So among the test study results, we saw that the fentanyl test strips led to 2 out of 3 users using less of a substance as a result of a positive test result. 59% of users actually went and got somebody else to be there with them when they used. 65%, again, 2 out of 3 users consumed more slowly. And all of these things have a very positive trajectory in terms of being able to mitigate the loss of life from overdose.
And so as you stand here today, as being in recovery, again, graduating top of your class, being the advocate for the recovery community, every situation is unique. And we hear about turning around and addressing the opioid crisis. And you just mentioned some pretty optimistic statistics. What is it going to take to be able to win this war?
So I think war is the wrong word to use. I think this is a societal problem that's been brewing for generations. It's a combination of a lack of family solidarity, a lack of genuine work opportunities and living wage. And I think that what we see is people trying to cope with human suffering. And so until we start to address some of the underlying causes of human suffering, that our issues with substance use are only going to continue to grow worse, because people are going to seek whatever it is that they have accessible to them to alleviate that suffering. So this is just the natural outcome of much larger forces that are at play. And really, it's a large part of how our democratic society has moved away from direct democracy, and we've moved closer into a capitalist autonomy. Our society is so focused on money that we've lost sense of the values that have kept us as a species healthy and happy.
And so you're there up at the State House, the advocacy efforts that are taking place. This is one particular bill that has garnered your opposition. You talk about fentanyl strips as well. What else from the legislative standpoint do you think the state can be doing to address recovery issues?
Absolutely. I think one of the best programs that we have that we're literally sitting on the cusp of negotiating are the law enforcement assisted diversion programs. It's looking to utilize our workforce from a public safety lens in a little bit different capacity to start to meet people where they're at and really try to get them engaged in treatment modalities and expanding existing treatment modalities. I mean, one of the most significant concerns for folks that are going through early treatment is that the administrative discharge, the fear of recurrence, or being sent out of treatment for just displaying the symptoms of the very condition that you came into treatment for. And so it's the only chronic health condition for which we discharge patients for showing symptoms of their disease. And so until we have things like treatment on demand, availability of residential treatment, affordable housing, being able to satisfy basic needs. I mean, those are things that contribute significantly to substance use, and not only substance use, but problematic or addictive behavior substance use that leads people to enter into these really risky situations where they could be exposed to a prosecution under the law.
And so let's talk a little bit about that. Again, that need for residential treatment. Does Rhode Island have enough?
Oh, it's almost virtually inaccessible for folks that don't have like an established network plan. I've had to walk through this process with many people in my experience working in recovery and supporting people in recovery. So if you don't have insurance, your options are almost non-existent. There is one provider in the state, and that's Amos House, that takes people in on a housing basis and then provides them support for their substance use recovery. Beyond that, there really is no other opportunity out there. There's a very long wait list for recovery housing beds. I've worked very hard in the past year. I actually engineered and designed the certification process to be compliant with NAR. And so I've been looking at and evaluating all of our statewide recovery residences and getting them funding for those beds. That's a big piece of our strategy to try to support people. But we also don't really offer a lot for folks that are still actively using. We start our treatment with, we need you to stop. And I think that when we're at that part, the people that are dying are not the people that, well, we need to stop. They're the people that are continuing to use because they're so overwhelmed by the combination of things that lead them to continue to use, that they do not necessarily retain the personal power to be able to do that. So we need to support them better. And the way that we do that is not by fear and not by power over, but by standing side by side with somebody and telling them, look, I understand where you are. How can we help you? And genuinely listening to those answers. And some of those answers that have come out of that is, you know, give us some education. Help us to understand what it is that we're using so we can keep ourselves safe. You know, give us those tools. Naloxone has been an incredible tool that has come out of largely efforts from the active use community saying, look, we don't want to die. This isn't our death wish. This is just what we're dealing with. And we have something that we want to use, and this can help save us. And we've started to see the impact of that. You know, we've started to see a decrease in death, despite the fact that there are now increasingly more toxic substances prevalent in our illicit substance supply. The supply has continued to grow more dangerous, yet death has declined. And that's a big credit to these efforts to try to get people engaged in traditional health care, to get the community health centers on board, to educate primary care physicians to recognize some of the symptoms of substance use and knowing how to make those referrals. We just simply need a much more robust system to be able to respond to the immediate need in early remission from substance use, to be able to deliver on that at that moment, treatment on demand. And if we start investing millions of dollars in criminalization, then we're not going to have the resources to do that.
And finally, talk with us while you're here, the Rhode Island Users Union. Can you explain a little bit about the organization, if you will?
Yeah, sure, I'd love to. So it's interesting. We've organized a model here that's a little bit different than the national models. And so we wanted to develop an environment that was inclusive. And so in doing that, we welcomed anybody who had lived experience with substance use to join us, who had both been negatively affected by the effects of stigma and negatively affected by the effects of prohibition, including across our history. So learning from some of our historical successes and kind of like the pitfalls that we've acquired through that. You know, the legalization of alcohol, now followed by, you know, many movements to legalize marijuana. We've learned a lot about what regulation can look like for, you know, substances that are mind altering. And I think that we can continue to learn from those and model better and better programs to start to bring our system into full economic compliance, right? So we don't have like a genuine market in which people can turn to satisfy demand. And so since we cannot extinguish demand through criminalization, and since people are going to continue to demand, we have to recognize that there has to be a way that we can sensibly do that in a way that's safe, that embraces people's health and their safety, embraces public safety, and gives them the opportunity to be engaged in conversations that don't involve shame, that don't involve, you know, being belittled, that, you know, really kind of embrace where they are and say, you know, what can we do to improve your circumstances? What can we do to make things better? I think safe consumption centers have been an excellent platform for that to occur within. They've shown in a longitudinal 10-year case study, they looked at the Vancouver model, and they found that folks who were within those walls were more than twice as likely to engage in recovery efforts than those who did not have access to those facilities. So I think that a lot of our data that's out there right now is really compelling in a different way to deal with what we're experiencing. And I think we can start to make our society a healthier and better place to live by just caring about each other and not blaming each other for really unfortunate accidents and circumstances.
How many folks do you think that you've heard their voices from as part of this users union?
So as of right now, we have a national organization that is comprised of thousands of individuals. And the effort that we have in front of us today with the letter that's going out to the Senate, and please, if you have an opportunity out there to take a few minutes to contact your local senators and let them know, please, you know, this is definitely a step in the wrong direction. I would greatly, greatly appreciate that. But I think it's really important for us to be really thoughtful about what we put into policy. You know, because once we put it down, it can be taken into whatever extremes that it can be through the way that it's written. And so our language is so important. And that's something that we talked about a lot through the National User Union organizing, is the use of language. We've created a separate and distinct dialogue for people that have substance use disorder that is stigmatizing, it's very negative, it's not solutions focused, it doesn't match any of the other evidence base that we have for practice, because we assume that by criminalization that these are acts which are not sanctioned or recognized by the greater public. And that creates a lot of problem, because we're not embracing patients who have recognized diagnosable disabling conditions in a way that supports their recovery or their health. We don't do this for anybody else. We don't shame cancer patients for getting sick and losing their hair. We're not like, oh, hey, look at that guy. He lost all his hair. He must be a cancer patient. You know, we don't do that to people. It's not right to do that to people. And we know from experience that when people have really negative attitudes cast towards them, that they don't do as well as they could.
Well, you can check out that letter that was written regarding this legislation that a number of those folks in the recovery community signed on to, again, opposed to this drug homicide bill. Mike, I appreciate your taking the time to come in and give us a full overview. Again, you can read that letter on GoLocal today. Thank you so much.
Thank you.
I'll let you go. Don't go anywhere. I'll be right back here in the Navigant Credit Union Broadcast Center.